studied medicine in Sweden, and of course physiology was one of the first courses where you were given the opportunity to think, and there was also an element of understanding, whereas if you did anatomy or histology, it was just learning things which were by heart. I interrupted my medical studies as a student. I got the opportunity to go and work together with some really outstanding scientists, Sackman and Neer, and they had developed this wonderful technique that you can use to measure ion channel activities in different cell types. I mean, this is of course the patch clamp technique. And during that time, I realized that this is so exciting. This is something I don't want to miss this opportunity. My research focused on the regulation of insulin and glucagon secretion from the pancreatic islets. And insulin and glucagon, they are the most important glucoregulatory hormones in the body. And we know that the release of these hormones is impaired in type 2 diabetes, which is of course a disease which affects an increasing number of people in our westernized societies. So here in Britain it might be up to 10% of the population that have diabetes, some of them that you don't even know about it. Our long-term aim of our research is to explain or understand exactly how these abnormalities occur and, if possible, to correct them. People sometimes ask me when will we have a cure against diabetes, and of course we know exactly how to cure or at least prevent diabetes. If we reverted to a 1920s lifestyle, I mean, we would perhaps almost eradicate type 2 diabetes. And we know that during the Second World War, there was the incidence of diabetes plummeted in Europe. One of our goals is to bridge the gap between genetics and function. Because I mean, our genetics colleagues in Oxford, they have been extremely successful during recent years. Have identified 75 genes that increase the risk of type 2 diabetes. And for most of these genes, we don't know what they are doing. In some ways, it's a bit daunting. I mean, you have this list of 75 genes and then try to work out how they work. The interesting thing is that many of these genes we had never heard about before, but it's almost a little bit like a Christmas present. Suddenly you're given this list of 75 genes, proteins, which are obviously very important in the regulation of hormone secretion in the pancreas and that lead to diabetes. And to be able to understand how some of at least a few of these genes act at the level of the beta cells or alpha cells. I mean, that will be a great achievement, I think, and I would enjoy that.